Good afternoon. My name is Edna Navarro-Vidaurre, the Assistant Director of Community Systems Development. On behalf of Illinois Action for Children, I would like to welcome you to today's webinar titled Finding and Enrolling Highest Need Children in Early Childhood Programs. To get us started, here are some basic housekeeping tips. This session is being recorded and will be available on our Partner Plan Act website for future viewing. All of the participants have been muted until the question and answer section. If you encounter technical issues, please use the chat box to send us a message or email Mercedes at mercedesgonzalez@actforchildren.org. We'd like to gather a little bit of information to understand who is participating on today's webinar. So we're going to take a very quick poll. We would like you to please let us know who you are. Are you an early childhood provider? Are you a collaboration leader? Are you a cross-sector partner, possibly in the health or social service sectors? Are you a state leader? And if you select other, if you wouldn't mind telling us what your other is in the chat box. About half of you have entered your answer. We'll wait a couple more seconds for folks to respond. Okay, thank you so much for submitting that answer. We're going to go ahead and now do another quick one to know where you're from. Are you from the southern region, the central region, the northern, or Cook County? We're going to open up that poll, and if you can go ahead and enter your answer there. All right, we've got a pretty good mixture of folks from all over the state. Couple more seconds. All right, great. Thank you so much for sharing that. And at this time, we'd like to have you think about any possible questions that you already came into the webinar thinking. If you want to share your questions in the chat box, we'll try to make sure that our presenter will get to answer those questions and provide the information that you're asking for. So without further ado, and as you think of the question, feel free to enter it in the chat box. Without further ado, I'd like to introduce today's presenter, is Leah Powell, Community Systems Director at Illinois Action for Children. Leah oversaw the work of the 11 Early Childhood Innovation Zones, which were communities funded through the Race to the Top Learning Challenge grant. The project actually saw a 12% increase in enrollment of very high-need children in high-quality early learning and development programs. Leah has also strengthened local community leadership to reduce domestic violence for the New York City Mayor's Office. She's increased participation in nationwide health and well-being campaigns for YMCAs, and she has advocated for systems and community change at the state and municipal level in early care and policy. Welcome, Leah.
Hi, Edna. Thank you, and thank you everybody for joining us today. I know that it's a Halloween, so first I want to say Happy Halloween to everybody, because that's the most exciting part of today. And hope that today's session helps to answer any questions that you might have about finding and enrolling any high-need populations into early learning programs. So I want to start us off with a question, just to pose for your consideration, to think how might we foster relationships with partners in our community to build systems that support successful enrollment of children from priority populations in high-quality early care and education programs. So I put that up there just for your consideration. So hold that in the back of your mind, and that will be a guiding thought to take us through today's presentation. When we think about priority populations, or what does it mean to find and enroll highest need children in early learning programs, let's first think about who are those children from priority populations. The Illinois Early Learning Council helped to identify the following populations as children for priority consideration. These are populations that are traditionally underserved by early learning programs. They're considered hard to reach, and they were also a priority for the work that was led with the innovation zones. And I know it's also a priority for work going throughout the state, whether that's a Head Start funded program, is the preschool expansion grant, or PI and PFA expansion. So children from priority populations are those who experience homelessness, children and parents from teen parents, those in the child welfare system, and that includes foster care or intact families, those with developmental delays or disabilities, identified or not identified, families living in poverty and deep poverty, and that's considered 100% of the federal poverty limit and also 50% of the federal poverty limit, and families who are linguistically isolated, new immigrants, and refugees. The families from priority populations experience common obstacles to enrollment. Based on our work with innovation zones and also based on work from the Early Learning Council and also work with collaborations from around the state, we've heard that some obstacles that may prevent programs from reaching their enrollment goals include transportation. It's hard to get to a program. Families may not be aware of the program. They may not be aware that early learning is an option for their child. They may not know that home visiting, for example, is also an option for their child. Work schedules can be very complicated for families. We have families working shift hours. Sometimes they work part-time. Sometimes they are on a shift that gets canceled. So that can be very difficult to have consistency in work schedules. Communication barriers, language, literacy, culture, the materials that our programs may create may not be something that's easily accessible for some of our families. Basic needs of families need to be met first. This might mean shelter, a bed, clothing, glasses, food. And then our systems are not always aligned. And what does that mean to say that our systems are not aligned? So sometimes communities end up looking a little bit like this. This is an example that we had from our North Lawndale Innovation Zone, where our systems are disconnected, and those systems may include an early childhood system, teen parent programs, homelessness, health and hospitals, support services for children and families. Sometimes there's sharing that's going on, and that's great, but very often it's based on relationships that people have, so there may not be consistency in how families and children are referred to each other's programs. A lot of times our programs end up working in silos. This could be because of a grant has told us to only work in a certain geography. This could also be that we have limited time, we have limited resources, and we may not be able to work across system. And sometimes it happens that our programs may even feel a little bit territorial. They may be afraid to share waiting lists or other information, fear of judgment, fear of competition. What we're looking to build in general is a more effective community system, and this is something, again, this slide is courtesy of the North Lawndale Innovation Zone through the work that they, sort of a vision that they had sent for their work. That includes cross-training, for example, shared voice across organizations, information sharing and resources, working together on enrollment and documentation, and also this idea of facilitating referrals from multiple organizations. And that last one there is really where we're going to go deep today, is to think about how in our early childhood systems, or even if we're not working in an early childhood system, but how could we work with our early childhood system to enroll more children who are high need into our early learning programs. So I want to start out actually with some direct strategies that we tried in our innovation zones. And this is kind of a unique experience that we had where the innovation zone spent time looking at data. They spoke with community members and community partners to dive in deep into the question of why are children from priority populations not enrolling in early learning programs right now. They did a root cause analysis and then mapped out strategies and solutions to try to understand what was going on. In North Lawndale, they had a very unique experience where the idea that they had ended up being very different from the work that they implemented. And the reason for that was because as soon as they got outside to work on their first plan, they realized that this community had many more children and families who were experiencing homelessness then was captured in the data that they had for that community. I sort of throw that out there as a caution that data tells us what data is captured, but it may not tell us the entire story. So one thing that's very important when you're thinking about enrolling and finding highest need children to get into early learning programs is to really think about there are numbers that are important, and how can we also learn more by getting outside of the building and really getting to know our community well and engaging our partners and diverse stakeholders into conversation. So the materials that I have up here are screenshots from a project that the North Lawndale Innovation Zone tried. And it started out actually with a smaller project with a small shelter called Lena Washington Shelter. It's no longer open, but it was kind of a very small mom and pop shelter. And the North Lawndale team built a relationship with that provider to connect the children from that shelter into early learning programs in that community. They had one-on-one relationships and helped to navigate applications and those relationships. They had an intake form, which is what you see on the left over here. So this is who was conducting a referral, some information about the family, and then through that they helped to navigate that process with from the homeless shelter into the early learning program. What happened next is kind of an evolution of that idea, where a safe haven is another homeless shelter that's in that community, and they came up with basically a roadmap for referral where the nurse provided a developmental screening. They then met with Illinois Action for Children staff. We actually were able to provide on-site child care enrollment at a safe haven, and then the child was able to get connected to early learning programs based on choice by the parents. So Illinois Action for Children served as a neutral referrer, in this case, providing information to families about early learning programs that were available to them. But what they did is they went directly to the shelter to give that information to families who were living in shelter, helping to work closely with case managers to let them know that early learning programs were available to families. One of the things that was also really nice about that is a lot of times case managers are working with homeless families to help the adult find, whether it's to find housing, find a job, to navigate through case management so that they could leave the shelter. A lot of times when a family is coming in and getting service from an intake worker or from a caseworker, that caseworker sees the adult and may give crayons or something for the child to color with, but may not be thinking of the child as a client as well. What was really nice about this partnership with North Lawndale and the homeless shelter is that they started to see that the child was a part of the case as well, and also the benefit of having the child in quality childcare allowed the parent to get their case management needs met and to meet their goals as well. Some of the children who were served by the North Lawndale through this pilot project, they also got developmental screening, so speech delays were addressed and some other things were as well. Now, North Lawndale wasn't the only innovation zone that worked on this strategy. Aurora also worked very closely with homeless programs. They were very innovative in working with their refugee program. Most of our innovation zones also work with early intervention as a direct partner to both screen children and then also get them connected to early learning opportunities. In Elgin and the south suburbs and in Alfeld, Riverdale, they work closely with public housing partners. So whether that was to host an event on site or to do family engagement or to do sort of a pop-up preschool, a sample of an early learning experience, that helped to bring to families where they already were information and a space to be able to ask questions about early learning, or just some exposure to see this is what early learning looks like. Our communities also worked in health clinics. They worked in elementary schools as well, so working to find families who had school-age children who may also have had a younger sibling who would have been interested in an early learning opportunity. Some of our places also tried on-site applications at a homeless shelter. So that was the example with the Safe Haven Foundation, where families could actually apply for early learning right at that homeless shelter. Likewise at the public housing development. And then something was also tried at the Mexican consulate, where there were what we called mother advocates who would go to the Mexican consulate and provide information and also provide opportunities for families to apply for early learning right on site. What's really special about that is the idea of community collaborations, family educators, people who are looking to enroll and find more children. for early learning programs is that they go where families are, and the idea is to really make it easy for families. So what you can think about is all the ways that you might be able to remove any extra steps that a family may encounter on their way to enrolling or applying for an early learning program. So all of those extra steps are extra work, and if you think of it like a cost, so as the price goes up for me or for a family, that becomes very easy to say no. It feels, that opportunity cost feels like too much. So what these innovation zones did that was so unique and special was to remove those extra steps by going to where families already were. And what that does is it makes things that feel very hard, and it makes those things easier. And what they did is they actually asked families what was hard and what would make it easier. So I'm going to throw out some questions for you just to consider, and again, this is to hold in the back of your mind. So steps for successful planning is to think about what feels feasible, about trying some new ideas, and what might concern you. So more specifically, we have a pipeline to facilitate enrollment, and this picture here helps to kind of break out into three pieces the phases of building a pipeline. So what you do is you look at who in the community is serving children from priority populations right now. This is something that you can do where you might make a list, and starting with those those partners that you may already know very well. And I'll explain to you why that matters in just a bit. Setting up a meeting with the director, asking if they would join you in a small experiment, using a script to help you talk, giving that director a script to say whatever it is that you can do to make it easy. So what I just said earlier about removing any of those steps that makes things hard, how do we help to remove any extra steps? We do the same thing with our partners as we're building relationships with them. So as we're thinking, how did Aurora build a relationship with the refugee agency? How did Elgin build a partnership with public housing? They started with those agencies that were serving children from priority populations, and they started with places where they had relationships, where those people were ready, willing, and able to join in an experiment. In the case of North Lawndale, for example, when they worked with a health clinic, they had a script that they created that they asked the doctors to be able to use to help make it easy, because not everybody knows what to say. But if you make it easy for them to say things, then everything is easy, and then we have more access. I like to say access equals easy, okay, or easy equals access. And then the last step is really to create that infrastructure to be able to process referrals to make sure that that's happening. So a visual map is this thing right here, where first this thing happens, the second activity happens, and then another activity, and that's really a workflow process that's done visually. And a benefit of a visual workflow process is that it's a neutral description of what is expected of each player in this pipeline relationship. So case manager will refer families who are homeless to the local collaboration, ABC collaboration, every Friday using email. And we call that who does what, how often, using what tools. And that way it's very clear for people so that we're not forgetting or letting families fall through the cracks. If we were simply to say, homeless shelter refers families to ABC collaboration, we wouldn't know who from the shelter is responsible for sending that referral over. We wouldn't know how it was going to come over, and we wouldn't know who is to receive that referral, including the next steps. So as these protocols are made clear, it makes it a lot easier for everybody to work together to understand what's expected. And that clarity of protocols, when you do that as a collaboration in a relationship, you're able to understand, again, what's hard and what would make it easier for your partner to be a part of this pipeline engagement. And last point, and we'll go into this a bit going forward, but the idea of checking in weekly. If weekly is too hard, at least monthly, having a regular active engagement with your partner in the pipeline to facilitate enrollment will really make your strategy more powerful. We did an experiment with a pediatrician, and checking in every weekly with her, I would learn things like questions that she had. Can children, who gets referred to a home visiting program? if a child isn't potty trained, can they be referred to such and such program? This pediatrician started to realize that the people that she wanted to ask every time were children who were 3 years old, because that seemed like a great opportunity. So when you check in weekly, you're able to uncover new information that can help you and that pipeline partner work collaboratively to facilitate that enrollment process. So I have some nice pictures here, and this is really just to give you everything that I just said. It's to just give a nice little picture of what that looks like. So an effective enrollment pipeline has more touch points. The usual way to recruit families is to have conversations with families one-on-one, maybe at information tables or community events. We could talk and be at an event for several hours. We might talk to 20 families and really end up with just one single referral. So this is what a 1-degree pipeline looks like. So me doing outreach, talking to one mom. We can make it more effective with a 2-degree pipeline. So me, for example, talking to a nurse, social worker, case manager at a homeless shelter. And then that case manager, for example, then can have many conversations with all of their clients. So in this picture here, we have a dad and then 2 moms. So that's 3 people. So I have one conversation with one person who then talks to 3 other people. Even more effective, and this is really what happens over time. So as that caseworker or social worker or nurse is having really great engagements with their clients about early learning, they spread the word and let their peers know, or it makes it easier for you to go to an executive director or head of that group to ask for more caseworkers, nurses, or social workers to be involved in your, it's really a 3rd-degree pipeline, but really this referral project that's done through word of mouth. So in some ways this reminds me of a marketing campaign where you could do an ad campaign with pieces of paper, but what this has done is built on relationships. It's based on trust. We learned from some of our Innovation Zone meetings that parents are very likely to listen to nurses, lawyers, caseworkers, doctors, different types of professionals when giving information, so that's a trusted resource for them, and those ended up being some of the partners that these communities worked with. As you're considering a pipeline project for your own community, some things to keep in mind are, again, who are the agencies or organizations that are serving families from priority populations, and 2, who of those agencies, who do the families in my community trust? So where are the relationships that would be very effective and impactful? So as a reflection, just thinking about this, so making sure to take a list of your possible partners. And what you might do is print this out, maybe grab a screenshot of this, or after the webinar is over, print out the slide, and have this conversation with your colleagues. So who do we have relationships with right now? Ask who is a willing partner, who is motivated right now. Are they referring families to early learning programs right now? If they are, why are they doing that? What's in it for them? And if they are not, why not? And how might we make it easier? Who is an easy partner to help us find families to connect to early learning? And do we have any partners who would be willing to work with us to test a few ideas right now? So again, that's really asking, who do you know? Thinking about the way to make an ask, to listen and be responsive. And then this idea of capture, nurture, so capture the contact, nurture the relationship, and then create some sort of systems or habits to keep that connection alive. And thinking ahead, I just want to add one more note, is that the more that you do the work, so say you start to build a pipeline relationship with one pediatrician or one caseworker at a homeless shelter, the more you do it, the better you get. So keeping in mind that it's not how great you start, it's how great you finish, and that's why we use the language of experiments and testing, so that you try something out in a trusted relationship where you're not trying something that's so big that is a high risk opportunity. You want to prove your purpose and prove the evidence that this is working, and as you practice with some people, then they can start to recommend you to hire to more people, and then the word starts to spread about the success of your work. we have some toolkits that we created where you can actually spend a little bit more time diving into this. This is on the Partner Plan Act website, and there is a toolkit. There's a whole section on there called Take Action to Enroll, and that's really about, this first one here is taking action to build a pipeline. And there's three toolkits that are in the series, and they also include talking points and scripts that you might play around with on your own. So as we consider the idea of going deeper to connect a partner request to action, we're always keeping in mind, again, what feels feasible and what might concern you. So these are some bonus tips for success that we wanted to share. So as you actively engage partners, again, that idea that you would engage with them weekly or all year long. So we'll pretend that we have a relationship that's made and we're learning and trying to get a little bit more information. So these are some screenshots that come from one of the toolkits, and the fancy language for this in sales is, they call it a conversion rate. So that's just a fancy way of saying, and I'm going to draw on this with the highlighter. So awareness is the first one here. Oh, my yellow highlighter is yellow, so I'm going to color that in. Awareness is kind of your step one. Consideration is where the person that you're trying to engage is considering the proposition that you've made to them. So first I've made my partner, my pipeline partner, aware that I am here and that I want to work with them to enroll more children from priority populations. So we'll say that homeless shelter is considering what I've said, and they're thinking, well, let me think about that. Once they make up their mind, that's where the action happens. And this is where the conversion rate, that's that fancy word, that's where the conversion rate happens. So I'm converting them from a potential client to a client, and then we're actually working together in a relationship to enroll more children and families from priority populations. Okay, let's see. Do I turn that off? Okay, normal. Okay. So right here I have stage one, and this describes during awareness, community leaders will learn about how collaborating with you would be good for their community. You may use this time to give information to your partner. You might share your vision for children in the community and realize that you have a shared vision. So our priority populations are also being served by these partners, and we share a vision for the outcome for their children. So you might say something like, we are a cross-system early childhood collaboration. Our goal is in line with the state's vision. Would you like to join us in a small and easy experiment to try to enroll more children from priority populations in high-quality early learning and development programs? Let's see if I can go next. So then it becomes consideration. So first they've become aware of you. You've made your kind of a pitch. You've shared some information about what it is that you hope to do. Hopefully you've talked about a shared vision for children and families in the community. And these are some tips here. So if you hear phrases that suggest that that individual, that collaboration partner, that they want to make a referral, they're interested, and that they're not sure what's expected of you, what you want to try here is to facilitate, and that's make it easier. So that pipeline partner says, you know, that sounds like a really great idea. I want to be a part of that, but where do I get started? How would I do something like that? That feels really hard to me. And then here's some tips that you might try. So you could share that visual flow chart that displays the steps in the enrollment pipeline. You can show them as an example to start a conversation, and then they could have a conversation back with you about whether or not that seems feasible or not. You could start very small. You would suggest, hey, why don't we start a small experiment? We can just work with one caseworker or pediatrician, try it for 1 month, look at the data, and then come back together to plan and learn and see what happens next. The other thing you might try is to give them a card, almost like a talking points card, with 3 simple sentences that they can use when they talk to families. So maybe they're not ready to make the referral just yet, but what they can do and what they're comfortable with is that they can just talk to families and let them know about early learning opportunities. So as that partner is considering, they're not only considering about maybe this is hard for me, but they may be considering, you know, I'm not sure about that. Sounds like a great idea, but is anybody else doing that? I don't want to be the only one. My motivation might not be that high to be a partner in this experiment. If you hear that this is a concern that they might have, you would try to listen to what they say and then perhaps try to spark their motivation. So here's some examples of things you could say. You might say, other medical professionals are joining communities of high need in this pilot. Would you like to hear about how it went with them? You could say, tell me more about your concerns. Really spend some time to listen and be responsive. Are there any things that I can address? So really what you want to do is to listen well and ask them what you learn. Perhaps they had a partnership with your organization in the past, and perhaps they had some issues with that. So it's always helpful to be a good listener and to just spend some time listening. Another thing that you can try is to introduce this caseworker or an executive director to someone else from another program. So I'd like to introduce you to Ms. Jones from the homeless shelter. She can share results of our pilot when we tried that about a month ago. And then working together, we were able to make a difference. So I always laugh. So when we write talking points, of course, they feel a little bit stilted. So of course, you would make these your own, but these are just examples of talking points that you might try. So if you hear that the pipeline partner feels eager to be a partner with you in a referral pipeline, and they say, this sounds easy, but I forgot, here's some things that you can do. And this one is really important because we found, especially with some of our innovation zones, that the pipelines would get started, there would be really great activity going on in these referrals, and then suddenly they would die down. And people get busy, and to stay on top and to stay actively engaged, we realized that what was happening is people were forgetting because there was either staff turnover or they simply did get busy, so it didn't have any, there was really no reason why they weren't making the referrals anymore, they just forgot. So here's some things that you can try. So you can create a system, whether that sends texts or Outlook calendar reminders, so that Jane from the homeless shelter sends a referral to ABC Collaboration, to me at ABC Collaboration, every Friday at noon. I could send her an Outlook reminder that triggers her to remember to send me those referrals. You can use web forms. You can use a Google form. You can use a form from a CRM system if you happen to have one. You could suggest that they create an easy-to-remember routine that we think of as when I, then I. So when I, pediatrician, check developmental milestones, then I will ask about early learning. And you can also set reminders for yourself, just to remember to reconnect or check in with your partners, again, at least monthly. If you can do it weekly, that's really ideal. A lot of this is, again, very similar to work that is done in sales. So some of the best tips that you're going to find might actually be from tips that people who work in sales do. So they have whether they're using Outlook, but they keep notes about the client or the person that they're building a relationship with. They get to know birth dates, they get to know the names of their children, they get to know them as a person and really engage in that relationship and spend time getting to know them. So sometimes the reminder is as simple as a phone call and then them saying, oh my gosh, I haven't heard from you in so long, it's really nice to hear from you. So 99% of this work is about relationships, and part of that is just reminding yourself and creating habits to be actively following through on that relationship building part of the work. So the last step in that is the action. So the more responsive that you can be in addressing these three needs of partners, again, so making it easier, helping them to remember, and sparking their interest or motivation, unpacking what's holding them back, the more likely they are to work with you. So if they say yes, that's great. So celebrate your first small win together. If they say no, I don't want to be a partner with you at that time, that's okay. So it may not be the right time for this partnership. You want to remember to do what you can do now and think about who else you can engage. Is there someone else that I have a relationship with? Is there someone else where this might be easy? And now if they say yes and they're forgetting to make referrals, revisit stage 2, which is right here in this consideration, and think about how you could set up a series of reminders, whether for you to stay in touch or for them to stay in touch with you. So here are these are examples here of the talking points, and I want to pull that up for you just so you can see what that actually looks like in real life here. So I know you can see my screen, and I'm going to go to the Partner Plan Act website here. And I just want to walk through and help you see that you can navigate this yourself. So you go to the partnerplanact.org website, and under Partner, there is a Toolkit section. And we have 2 here right now, and one that will be added before Thanksgiving. So Take Action to Enroll is the one that we were just spending some time digging into. And what we have here, you can download it as a PDF and keep that as a file for your records. You can print that. The other thing you can do is it's designed as a flip book, so if you just wanted to scan that on your screen, that's something you can look at as well. There's short little videos if you want to have almost like a small snippet of what is involved in each of these toolkits. And then these are what some of the talking points look like here. Oops, so you can click to read it. So this is something that, in creating an effective pipeline, what you might be able to say to an organization leader. And then the second column is something that those leaders may be able to say to parents. And then take action to enroll more children from priority populations. So these are stages moving towards enrollment. And then that dives into some of the content we just reviewed. And again, some more talking points, and then taking action to know your audience. And so this is really one step deeper in terms of understanding those 3 areas that I was talking about, of it being easy, having motivation, and remembering to do the activity. And again, we have some talking points there. Okay. So I want to pause for a second, and I just want to see, let's see, whoops. How do I see? I have to see my screen again. Whoopsies. Back over here. There we go. All right. So I want to see if there's any questions that we have or anything in the chat box. Oops. Oh yeah, so the website for the Pipeline Toolkit, so that's on the www.partnerplanact.org. Now I know that I went through some of the content really quickly, and what's part of the reason why I go through it fast is, one is that I talk really fast, but I also really want to help and see if there's anything that we can learn from each other. So I tried to leave a little bit of time for folks in the chat box, and I guess Edna can let me know if we can unmute people so that there can be a little bit of conversation, if that's possible. With the number of people, it may be best to use the chat box. But I know that for peer learning, it is very helpful for us to talk about and learn from each other, because here I am presenting this information, but maybe you've already been trying this yourself. I feel like we have a field of people who are experts, and what is it that you have tried in the past, and what obstacles do you think may be preventing you from building a pipeline for referral and enrollment? So I want to encourage you to make this interactive. I know that sometimes when we're on a webinar, it's sort of a new experience, but let's try it out. And I'm going to pause, and I'm going to wait for folks to type into the chat box answers to the first question. What obstacles do you think are preventing you from building a pipeline for referral and enrollment? Any questions? Let's see. No questions so far. Okay. I'm going to show you one other toolkit because I think it'll give some context for why we phrase the questions in the way that we do, is, let me show you on this website here. So going back to the Partner Plan Act website here. So this is Take Action to Enroll, and then this is really the 3 guides about enrollment, and then Take Action to Implement. So what we did is we created an action learning toolkit, and if anyone is willing to kind of go out there and try this pipeline idea, how do I build a pipeline? A key part of that is really to think in an action learning kind of way. Let me do it this way. And that means to use a CQI process where there's reflective learning, and I'm kind of scrolling through this, but really looking at how things are working right now, doing a series of small experiments to help you get to that vision, and then continuing to work along the way to get better and get better and get better, closer to where you're going. This is a target map that's here, and I think that it's a nice picture to help understand that where we are right now is on the outside, the vision is on the inside, and it may be aspirational. And each time we try, we get a little bit closer with each one of our experiments. So we're really trying to get closer and closer, knowing that what is out there might be hard. So to have kind of that ideal community system where everyone's making referrals to and from each other can feel very hard. And the idea that that's okay, but that you are trying to really make it work. In this one here, we have this other PDF, and this is really a toolkit itself. So there's 5 questions that what I encourage people to do is to print out these 2 pages back to back, and then carry a little card around with you. So one of these boxes here is a card where you ask, what is the target condition? And so my target might be that I'm trying to work with, I'm trying to have, the local Salvation Army refer families from their shelter over to me so that we could work together. Or it may be that I'm trying to work with a home visiting program to have strong transition plans so that when children are turning 3, that they are being connected to early learning programs. Another target could be that I'm working with early intervention, and that as children are transitioning again at age 2.5, 3 years old, that I'm starting to talk to them about early learning programs. So there's many opportunities. And then you would ask that question, so what is going on right now? What obstacles do you think are getting in the way? What are you going to try next, and how can you learn from that step? And then using kind of a parking lot to help you track everything that might be getting in the way, and then working on one to be able to move your work forward. So it's kind of a way to build reflective practice into the innovative work that you're trying to do in terms of building a pipeline. Okay, so that's actually where these questions came from here. And then I guess we're just going to see if there are any other questions that people might have. All right. So I'm trying to think about if there might be some other examples that we had from innovation zones that are useful in terms of a pipeline. If people did have questions, it would help me to kind of target the stories I could share with you. We had one interesting thing was in Elgin, they started out doing what they called the pop-up preschool, and that was under different federal funding. and they tried to create a pop-up preschool, small sample of preschool in their community. When Innovation Zones came about through the Race to the Top Early Learning Challenge grant, the Cicero team ended up going out to Elgin to learn about their pop-up preschool. Cicero then launched their own pop-up preschool, and what they did that was a little bit different was they had an AOK program, AOK network already in their community. They also had a McV program in their community, and then they really linked their pop-up preschool and parent engagement work directly to the AOK network and to the McV program. So the AOK network had relationships that they were building with different partners in the community. The AOK network was working with early intervention. They were working with the WIC and TANF office. They were also working with home visitors and different partners in the community. The McV program is also working with home visitors. So together, the three programs would, one of the teams was really the beginning of the pipeline. So they had parents who were out meeting families in the community, hosting pop-up preschools, and the parent would express their interest in early learning, or the staff would talk to the parent about early learning programs or home visiting programs, and then the coordinated intake worker from McV would then give them information about how to access and how to get connected into these systems. The AOK network had all these really fabulous relationships with even health providers, domestic violence, and other different types of support services, so that the full needs of the family could be met through these different interactions. So they ended up creating really a complex but very seamless pipeline across the different initiatives that they had. So that was really great. And then, Edna, can I get you to share a story?
Actually, there's a couple of questions in the chat box. If you can take a look at those and answer those, that'd be great.
Oh, good. I didn't see that they came through. Okay. So what advice would you have for community partners that attend the collaboration meeting, but that are not in agreement or on board with the work that the group is doing? I think that's a great question. I would suggest that you spend some time actually just asking them, and I'm sure you've already done this, but really helping to understand what are, where is it that you have shared vision and shared values, to be able to think about the work that they are doing. Let me just pop this out for a second. I'm not sure if that's helpful, but sometimes you have partners who are coming to a meeting and really that idea of what's hard and what would make it easier, doing almost a small survey or coming up with a series of questions to help understand what their values are, what their needs are, what their interests are, and then asking them how they would like to engage in the collaboration in terms of building a pipeline can be very helpful. And then another question here is wondering how referrals go with doctors or other service providers when only some of the patients reside in our referral area. It's also a great question. So sometimes you end up doing a good service that serves other children who may not be in your community, and sometimes you end up helping children and families that are directly in your community. You can start out if you have a relationship, say, with a doctor or other provider who is serving fewer families from your community, and then as you build relationships and as they're kind of doing this, you start to build relationships with those who are serving the families in your zip code directly. I think it's pretty common that there are families in a community who come from another area to get their service there, or maybe there's a central public health department where families are being served from a wider county area. And then how do we find money for a central intake position or coordinated intake position? I wish I knew. I think probably through, I'm going to have to suggest through grant writing or through private funds. If you have an AOK network in your community, or if you have McVs in your community, it might be worth talking to them and see if they already have a position there that's doing that type of work. We've also found that there's types of coordinated intake, these central intake positions that may also come through the homeless shelter system. So one thing that's really powerful about collaboration work is that we are stronger together, and we may not be able to do all of the ideas that we have the ideas to do, but there are partners who may also be leading that work, and we can join with them as the lead, and we can help bring our ideas to the table. So there may not always be money for coordinated intake or central intake, but we can work with other partners to see if we might bring that to life. And you may try it kind of as a volunteer. See if you can get anyone to volunteer their time to be able to do that. Does that answer your questions? Oh, and then another question we received was some concern about when we have limited capacity. So we may get a pipeline going and then not have enough capacity to be able to service the families who are in our care. That is true, and that does happen as well. So I guess sometimes it's almost spending the time to think about what happens if you're successful. So what are the dangers of being successful? So a danger of being successful is that we fill all of our slots with children who are highest need. What some of our communities found is that it's one thing to fill your slots, but it's another to keep attendance going. And so then the strategies may shift to meeting basic needs or finding the different supports or doing the discovery to understand what is keeping families from attending programs on a regular basis. So that's another consideration to kind of hold in your mind is if we work hard and set a vision and then we're successful, then what happens? But for the most part, what we found with our work with collaborations is that a lot of our programs do tend to be under-enrolled, and if they are enrolled, they may not be enrolled with children who are highest need, and that some of these strategies can really help sometimes shift who is in the program to make sure that the most vulnerable families are being served, and then once they are served, can we keep them enrolled in our programs? And then as a way to find success for people who've found grants with coordinated intake or central intake and found volunteer support. What we can do is we can send that out to the group. I feel like that's a really great question, and we can reach out to you directly and get that answer to you. But if there's anyone who's on the call or on the webinar right now who's had success getting grants for central or coordinated intake, or found the ability to support that, if you'd let us know, that would be great. Okay, I'm just looking to see if there's other questions. Something that's frustrating is when agencies have so many HIPAA regulations, laws, requirements. How do we fix this? So that's another great question. So there was a shared data agreement that was done from one of the collaborations that was working with a pediatrician's office. They did have a data share agreement that the hospital initiated, so it was based on the terms that they could use. So what they did is they would send the name. A parent would agree to have the child's name sent, so the parent would agree, and then it would be sent through a secure email address, like through a secure email system to the team that received that. So if you want more information about that, you can reach out to me directly, and I can share some of the lessons learned that they had to work directly with doctors to get names of children from the referral process. Okay. Well, gosh, thank you so much. This is a good experiment to try asking questions, asking and answering questions. So I appreciate everyone who submitted an idea and their thoughts. It's really wonderful. And we'd like to continue the conversation. I'm going to turn it over to Edna, who's going to help close us out. She has a poll and she's got some announcements here. Before we do that, I just want to say thank you to Edna for her leadership, serving as a champion for children and families at Illinois Action for Children for the last 4+ years. I hope you guys will join me in wishing Edna well. This is her last day. And we're so grateful and thankful for everything that she's done. If you guys have time and want to share in the chat box, give a little shout out to Edna because she's awesome. But Edna, I'll turn it over to you to wrap us up.
Thanks, Leah, for that great send-off, and thank all of you for joining us today. Just really quickly, I want to make sure that all of you know that we have 4 caucuses planned throughout the state, and we really hope that you are able to join us at one of them. The material will be the same, but we want to make sure to get out to you, and we will be learning more and making decisions based on your input and feedback around preschool expulsion legislation, learning more about the Children's Health Insurance Program, and the Child Care Working Families Act. We want to make sure that we build in time for you guys to network and inform our legislative policies. So please make sure to check out the dates, the locations, and please note that the Chicago location in December is going to be in the evening. Please go to the actforchildren.org/event website to register today. You can feel free to share this information with your community partners. The more, the merrier. Next up is, let's see, just a really quick poll to find out how valuable today's presentation was. So if you can please take a couple seconds to enter your choice of it being valuable, slightly valuable, moderately valuable, very valuable, or not valuable at all. If you could please take a couple seconds to enter that answer in there. It helps us. We look for feedback so we can always try to improve any webinar, any supports that we designed for you. So if you can just take a second or two. Sorry, we had a little bit of a technical glitch. If you could enter your answer. All right, thank you so much for that feedback. And at this time, I would just like to thank you for your time today. This webinar was made possible through the generous support of the Grand Victoria Foundation. Thanks again for your support throughout our webinar series, and I'm sure our paths will cross again. Have a good day. This concludes our webinar.